just going to share some slides from the actual talk, looking at technique of endotracheal intubation, how not to rock the laryngoscope, how to lift it, upwards at the proper angle, for instance. This is a view of the vocal cords and how the ET tube should be placed in under direct visualization. Okay. Then this is just simply spirometry. This is coming from the physiological side of things, explaining tidal volumes, inspiratory, expiratory, reserve volume, residual volume, capacities, breaking into examples like that. And this is just to once again illustrate the lung compliance, which is very important parameter to monitor in ventilation. Just explaining the pathophysiology and the normal physiology, first of all, in order to understand pathophysiology. Obviously, we'll expand more on this during the actual talk.
Welcome to the Masterclass on Mechanical Ventilation Information Session. Whether you're a student, a new clinician, or a seasoned provider looking to refine your skills, we're so glad you're here. Managing critically ill patients can be one of the most challenging and rewarding parts of clinical care. And tonight, you're taking a powerful step forward. This session is designed to help you cut through the complexity, to make intubation less intimidating, and to help you approach the ventilator with confidence, not confusion. You'll learn how to perform endotracheal intubation with clarity, the fundamentals of setting up and managing a ventilator, how to protect the lungs using safe ventilation strategies. We'll also dive into non-invasive ventilation and explore the physiologic and pathologic consequences of mechanical ventilation. This masterclass is more than a lecture, it's a foundation for safer care, sharper clinical thinking, and stronger outcomes for your patients. Thank you for joining us today. Let's get started.
Yay, this is what we are all about. Good evening, colleagues, and welcome to the Clinical Care Platform. This is the information session, and we are going to be looking at our upcoming masterclass this coming weekend on mechanical ventilation. Thank you very much for joining us. How are you guys doing? In the chat there, type in, just say, hey, this is how I'm doing. I'm good. I'm not good. Also share there from where are you joining. Also, let us know if you have already registered and you are looking forward to joining us this Saturday. I am not alone as always. I am with Dr. Ryan Swepesat, my dearest brother there. Hi, Brother Ryan. Welcome to the platform. Are you good?
Good. Thank you, Brother Liz. How are you?
No. All is well. All is well. Last night I was
Wonderful.
teaching with a funny itchy throat. Today it's a bit frothy, but I think I'm okay. I'm good so far. Yeah.
Frothy.
I need to see a physician. I need to see you, brother, right?
Yes.
Can I send my helicopter?
No problem. Anytime, brother. Anytime.
All right, colleagues, just as an introduction, we are the clinical care platform. We exist to improve patient care, and we enable this by empowering you as a health professional to always have the up-to-date knowledge, to be competent, and to be confident, caring for our patients out there. Today, we are introducing the Mechanical Ventilation Masterclass. It is actually one of many of the other master classes, particularly in internal medicine. We have the ECG masterclass, we have the lab interpretation masterclass, we have the chest x-ray masterclass, we have the diploma coaching program, and I want to tell you that the part 1 coaching program in internal medicine is also coming your way, and we already have the part 2 exam. So we are that institution which can take you, from wherever you are and provide the necessary support until, you become that specialist. And hopefully when you graduate, you come back on the platform, you add value to other clinicians. On that note, I'm not going to waste a lot of time, But to hand over to brother Dr. Raitz Pesat to take us through, just to give you an idea of what you can expect on Saturday. And immediately after that, we will have a discussion, and I'll tell you a little bit more about some of the administrative issues. Yeah, so I'm hoping you can see Dr. Ryan's slides. Yes, we can see your slides, brother. It's all good. Thank you.
Wonderful. Thank you, Dr. Mawela, Brother Liz. Good
Welcome.
evening, everybody. God bless you. Thanks for joining us. It's a wacky Wednesday, and you have joined us at 6 o'clock for our info session, mechanical ventilation. Thanks for taking the time to join us and to find out what Saturday's masterclass is all about. We are so happy to see you. Let's get started, guys. So this is the course structure and outline. So we have designed this course to take somebody who knows not much about mechanical ventilation to being relatively comfortable setting up the vent for the patient. Okay, so we're going to cover a little bit about endotracheal intubation, just the procedure. I'm going to give you some nuggets from my experiences. Okay, and then talk about introduction to mechanical ventilation. We're going to first look at the basic science behind it and to tackle some physiological concepts like understanding normal lung mechanics and then how to monitor lung mechanics. And then what does normal gas exchange mean and how do we monitor the efficacy of gas exchange? Then we're going to break into non-invasive positive pressure ventilation, talking about CPAP and BiPAP and the differences, etc. We're going to look at ventilator modes. So volume control, pressure control, SIMV, pressure support, etc. And then look at different ventilator options. Then we're going to focus a bit on lung protective ventilation, especially in acute respiratory distress syndrome. This was the dreaded complication of COVID, if you remember going back a couple of years. So we have to talk about lung protective ventilation, and then looking at the physiological and the pathological consequences of mechanical ventilation. And lastly, we're going to have a consolidation session where we put everything together in terms of setting modes, how to troubleshoot a patient on the vent. And then I also have access to an online ventilator simulator. So that will be the last session where we go on this online vent simulator and I introduce you to a variety of different vents and how to actually go about setting up the vent, albeit not physically, but on online simulation, okay? Yeah, there's lots of illustrations in the talk, okay, illustrating proper technique when intubating patients, what to do, what not to do. This is just, visual representation of what you should be viewing when you're intubating between those vocal cords, okay? And then, of course, this is the physiology that we spoke about. Lung volumes, your inspiratory reserve, expiratory reserve, your tidal volumes, and this all feeds into the physiology that we will be discussing regarding lung mechanics and gas exchange. Okay, so more on this obviously on Saturday. So I also got a variety of diagrams explaining things like lung compliance, which is the defensibility or so-called stretchability, you like, of the lung. So we cover it from a physiological perspective in terms of the different forces, and then that'll try to foster a basic understanding of lung compliance. And then we look at what happens in the pathophysiological situation. Yeah, here I also introduce you to concepts like peak pressure and plateau pressure. This is especially important when you're trying to troubleshoot the vent. If your patient's not ventilating well, is the problem in the airway, in the tube, or is the problem in the lungs? So we compute things called the peak pressure, the plateau pressure, and I'll show you how to determine the differential for the difficulty you're having based on these different parameters, okay? Then, of course, this is taken from gas exchange to understand arterial blood gas and ventilation and oxygenation, two very important but parallel different processes and how to monitor these. Okay, and this is taken from the non-invasive vent section, talking about CPAP and BiPAP and typical settings and what are the indications, where would you use it, when would it be unsuccessful and you have to opt to go on to intubate the patient. Okay, this is an example of capnography and also just looking at pressure control ventilation as an example, looking at graphs of flow, pressure, and volume to help you guys understand the mechanics of ventilation. And then, of course, we talk about some initial vent settings. So what mode, the FiO2, what tidal volume are you targeting for your patient, how to set the rate, what is PEEP, positive end expiratory pressure, why is it important, okay, pressure support, etc. Okay, this is taken from the lecture on the complications of mechanical ventilation. Then we'll talk about concepts of hemodynamics, gas exchange, monitoring, even touch on cerebral perfusion pressure, which is very important when you are ventilating head trauma patients, okay? This is an example taken from the pathological complications of ventilation. This, of course, being a complete whiteout of the lung. Maybe you only intubating the right side of the lung, which is a common complication, guys. When you intubate too deeply, only the right lung gets ventilated and the left doesn't because of the natural inclination of the right bronchus compared to the left. Okay, and then I'll take you through some examples of vent settings and some beautiful, beautiful algorithms. So this is the algorithm when considering extubation. What do you want to check for? What are the readiness criteria? What does a spontaneous breathing trial entail? How do we go about carrying this out? I also got some reading materials for you guys, including the Oxford Handbook and Intensive Care Fundamentals, two very powerful resources. Now, remember, guys, that critical care is a huge discipline. Mechanical ventilation is only one component of what is a very, very comprehensive discipline. So, if you want a proper foundation in other aspects of ICU care, I encourage you to read these resources, which will be available to you if you register. Then we talk about rapid sequence intubation, the 7Ps. Here's an example of an expansion of the alveolar arterial oxygen gradient. Now, this, guys, we're going to be talking about tomorrow. We got a beautiful lecture on approaching hypoxemia, right? And that's going to be happening tomorrow, 6:30 on the clinical care platform. So watch this space. We'll be talking about that tomorrow. A little bit on acid-base analysis, which is important, right? Because there's a metabolic and then there's respiratory issues and how to tease these apart. And of course, this is a beautiful kind of summary slide on the different vent modes, so volume control, pressure regulated volume control, SIMV, pressure support, etc. But of these, of course, those of us who are familiar with ventilation, you'll know that we often use pressure control, volume control. We hardly ever use SIMV unless you're a surgeon, okay? And pressure support is what we use as a so-called weaning mode. Okay, and of course, I got my jokes along the way as well. So this patient was recently extubated, and she says, wait, the ventilator, does it have Wi-Fi? Because, in this day and age, we can't survive without Wi-Fi, right? And this is me after laughing at my own jokes. I sometimes need to ventilate myself, but my jokes are so bad. Brother Mawela, that was my side, brother. Over to
Hey,
you.
Ryan, why are you ventilating yourself?
But I got like frothy sputum in my throat, you see. Yesterday it was itchy, today it's frothy.
Hey, brother Ryan. All right, colleagues. Brother Ryan, thank you so much. I think that was very empowering. Colleagues, maybe let me take you through to. Let me do this. Where is the sharing off screen thing? No, not that. Yeah. I'd like to just show you how to navigate our website if you are interested to register. I did share the link on the chat. You can click on the link or you can just visit our website, www.clinicalcareplatform.com. This is our home page. You can either go to where it says webinars there. You'll find some of the upcoming events. But if you scroll down on the same homepage, I think you'll see the first upcoming event is the Masterclass on Mechanical Ventilation. Then we also do have the Palpation Fine Needle Aspiration Bootcamp, which is in person, but we will launch the virtual registration will open tomorrow, I think. As I heard the team saying they should be ready by then. So yeah, so this is it. So you say, I want to learn more. So there's a learn more button there, which you will click. If you click on it, it will take you to the course page. Sorry, my MacBook is reacting. Okay, so you can see this is now where you can read more about the course. If you have made up your mind, you can actually just book your seat. But you'll see as you scroll down, you can see the details that this event is happening on the 18th. Between 8 and 15 hours. It's a virtual event. There's about 12 sessions that we need to go through. You can also get a sense of how Dr. Ryan teaches. There's a short 5-minute video there that you can go through. The program is accredited for at least 7 CPD points. So everyone who registers and attends adequately, you'll be eligible for that, and you can read a little bit more about that. So if you have made up your mind, you can click on register today on your right corner there, or you can go back and say, I'm ready, I want to book my seat, which is what I'm currently trying to do. And then now you are on the payment and registration page. You can see the masterclass is $950. If you are interested to join the palpation fine needle aspiration, you can just click on this square there. So that means you'll be registering for 2 programs at the same time, and there are some savings for you if you do that. We don't usually collect a lot of information as a platform. It's just basic, your names, your email, and then your council registration number, because we need it for reporting your CPDs, etc. If you're not able to transact with us in rands, you can just click on update currency, maybe change to dollars. We do have a lot of people outside South Africa who join our programs. And lastly, if you are a member, you can actually apply for a discount by clicking on apply coupon code right there. Once you click on it, you're going to have this section here. You need to use capital letters to just type in member 25, like I've done there. And you'll see it's $950, right? But once you apply the member 25 code, you would save about 95 rands, and then your registration fee is already calculated as $855. You would then complete your details and then click on continue, and you would see that this is a secured site. We do not have the ability to see any of your private information, including your payment details. Payments are processed by PayFast, which is probably the most trusted online transaction platform. And you'll find that once you click there, there's also many options that you can use to pay. You can use Samsung Pay, Apple Pay. You can also, maybe you don't have money now, you can actually apply for a quick assistance. Within 2 minutes, you would know that you can get help to register now and pay later. So that's why we use it. It's only for your benefit. So I hope that you have found that to be useful. And before I go through some questions with Brother Ryan, I would love if you could type in any questions you have, any comments that you may have, and immediately after this short video, we will then go through your questions. Yeah.
Rapid sequence induction entails the use of succinylcholine, which is a depolarizing muscle relaxant. Right, you got to pre-oxygenate the patient and an induction agent. Okay, so you can choose. There's a couple of induction agents we have. There's ketamine, and propofol, which are probably more popular. And there's also etomidate as well that you could use. So classic RSI entails these 4 entities: high blood pressure, pre-oxygenation, induction, followed by muscle relaxation. But we have the modified rapid sequence induction, which just entails, instead of succinylcholine, now we're using rock, right, which is another kind of muscle relaxant. The difference between succinylcholine and rocuronium or vicuronium, for instance, is that succinylcholine has a rapid...
Yeah, we almost gave you the whole course there. So I thought, hey, it's time to register now, colleagues. So welcome, colleagues. Brother Ryan, I think we can go through a number of discussion points, which are common, questions whenever we do these information sessions. People who join, they always have a question whether am I the right person for this program? Is it only for, I don't know, medical officers? Who else can benefit from this masterclass?
Okay, so anybody who is involved with management of critically ill patients, okay, you may be a paramedic, you may be a physician assistant, you may be somebody, even a young doctor, a medical student doing anesthetics, or maybe you're an intern, pump serve officer out there in the district hospital, and you get patients crashing on you, and you need to have a firm foundation in terms of intubation and mechanical ventilation. So, buddy, and maybe you're a seasoned professional, maybe you're a seasoned consultant who just wants a little bit of a refresher. This is also for you. So anybody who's involved in critical care.
Awesome, awesome. I mean, Ryan, I've personally found ventilation to be intimidating. I must be honest with you. How did you get around it? You are even teaching it. How did you get around it to get to be
Um,
more confident with the knobs and stuff? Yeah.
well, the knob carry and the assegai. No, 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 no. Then Nelson Mandela said, take your knob carry and throw it in the ocean.
Yeah.
No, brother. Well, we rotate as registrars. We rotate through ICU. So we
Yeah.
spend 3 months in ICU.
Yeah.
It's where I really got a love for pip care. I wouldn't say it's my favorite,
Mm,
but it's something. And because of COVID, I mean, we became intimately familiar. Even if you are not a professional in training,
mm,
I mean, even the ComServe officers out there were required to ventilate and manage patients. So this is a very helpful skill, and it could mean the difference between life and death
mm,
in your patient. So
mm.
the wonderful skill to have in your armamentarium as being a
Awesome.
doctor.
Awesome. Thanks, Brother Ryan. Colleagues, some of the common questions that we usually get have to do with, will I get CPDs? I think if you have done any programs with us, you would know that that is a non-negotiable. So if you register, regardless of whether you are a member or not, there's still a requirement that you must attend because that's what we are reporting to the council. So you need to attend adequately for you to get your certificate and then also your credentials. The other question usually some people say, well, I want to attend, but I'm on call, or I don't know, I'm only available half the time. So to navigate that, what we usually do after this master classes, we prepare a self-paced version of it with all the modules that Dr. Ryan is going to cover and additional materials as needed, which you will have access to regardless of whether you have attended successfully or not. So if you have attended successfully, maybe your interest is to revise. If you have not attended successfully, maybe you want to go through the program, and the system will measure how much you have covered. And if you reach at least 80% of the content, you should be able to get your certificate, and we are able to report your CPDs like that. Yeah, so this is awesome, Brother Ryan. I know we also have nurses who work in this space. I mean, I must be honest. Whenever I go to ICU, uh, they just ask me. The nurses, they just saw my face. All right, this one doesn't know much. They will nicely ask you and then direct you in the right direction. So you see that knob, maybe try it a bit. So, what do you want to say to the nurses who are interested in ICU medicine or they're already working there? I know we have
Yeah.
clinical associates as well. We might have interns
Yeah.
as well, who might,
Hmm.
I don't know in undergrad how much of ICU medicine is done. We just figure it out as we
Yeah.
go. Yeah,
Yeah, brother, from my experience when it comes to nurses, those in the critical care space
yeah,
are very
yeah,
experienced
very
and
good.
they can probably teach us, a thing or two.
Mm,
But if you're a nurse who's looking towards that specialty stream and you're not really in there yet,
mm,
this will give you a good foundation. But I think if you're already in crit care as a professional nurse, then
mm,
this might be maybe a little bit basic for you, because I mean, as a physician, I don't work in ICU all that much.
mm,
But if you're working in ICU all day, every day,
mm.
then you're bound to be much more experienced. But so if you're looking to get into crit care, you're considering that this is a good foundation for you.
Awesome, awesome, awesome. Now, colleagues, please type in the chat there if you are planning to join us. Just type a yes. If you are not sure, just say not sure. If you are not joining us, says next time. I just want to get a sense of your interest to join us this Saturday. Brother Ryan, you teach every moment you get. Every morning I see you are posting, you have a YouTube channel, you are here, you are preparing for the part one internal medicine. We are coaching that. Why, Brother Ryan? What gives
Ish.
you, what is the why that makes you jump out of bed and just say, today I'm going to add value to more professionals?
No, I wanted to ask you for a holiday, actually.
No, there's no holiday here. We are mission driven. We are driven by purpose. When God gives you a purpose
Yeah.
and a gift, there's no, when it comes
Amen.
back, it'll be counting there. So I gave you two. you're bringing me to. No, 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 no. That's not.
Absolutely. Yes, brother, your vocation, what you do, is only a small part of who you are.
Yeah,
And I truly believe that God wants to accomplish something great through everyone He created.
yeah,
So teaching is something that I just love to do.
yeah,
I mean, whether it's church, whether it's music, I mean, whether it's medicine, I
yeah.
just love to empower other people, you
Yes,
know? So
yes.
that's me.
Yeah, I think I haven't seen anyone who has achieved anything great. Firstly, who does it alone. And then
Mm,
if they have people around them, they spend a lot of time enabling them, equipping them, empowering them. Then you get a multiplier effect. The impact you are able to do, as Brother Ryan at PMB, suddenly it's done everywhere. In South Africa, we have more and more people who love their patients, who are confident, who are competent, and that's how we transform the health system. I remember
amen.
there's a master class where we didn't have a lot of registrations, and you reminded me of the why. I don't know if you remember. You said, let's go. Remember, one health worker at a time. We are transforming the health system
Yes,
one health worker at a time. So, colleagues, if one of you
yes,
joins us on Saturday, I can tell you it will be you, Brother Ryan, and Lesejo. And we shall make sure that we leave you very happy and confident. So, I think I
amen.
needed you to understand why we do this awesome work. All right. I
Yes,
think that's it. Maybe, Brother Ryan, we do have our diplomats here. I've seen some of them.
yes.
They are here. I don't know how much of critical care is in the exam. How
Oh,
how will the diplomat can the diplomats benefit from this session? I don't know how much of it is there. It's what's your sense around that? Yeah.
the benefit from a practical standpoint, brother,
Mm,
in
mm.
terms of day-to-day management, but the crit care is not examined
Yeah.
in the diploma blueprints.
Okay.
So it's not an examinable topic, but if you want to
Yeah.
sharpen your skill set and become competent in this technique, you are
Awesome.
welcome. All welcome.
Awesome. Awesome. And the follow up will be at a part two, or it will be covered in the intermediates. How does that work in terms of critical care?
Oh, crit care. No, brother, crit care is a subspecialty. So
Okay.
if you're a surgeon or you're a physician or you're a gynae and you
Mm,
have a special interest in crit care, then you can do another 2 years.
mm,
Sometimes it's even shorter, and then
mm.
you do a subspecialty certificate exam.
Okay.
But of course, if you're an anesthetist, then crit care is like part of
It's
your
part of
body.
it. Yeah. Yeah. All right, colleagues. Colleagues, on that note, we want to call it an evening just to say thank you so much for joining us. Me and Brother Ryan at 7 o'clock, we are coaching colleagues who are going to write the HPCSA board exam, and we don't stop. Whenever we get time, we want to really add value. So if you know colleagues who are going to write, let them know that we do have a program which they can join, and today we are preparing them for the OSCEs. I can also tell you that at 6:30 now, the diploma in ophthalmology coaching program is starting. At 8 o'clock, the diploma in HIV medicine. We're starting, we're discussing prevention, lenacapavir, and all those modern things. And last night we had Brother Ryan coaching the internal medicine colleagues on endocrinology. I'm telling you, it's so beautiful. It's so awesome to see the value and the impact we have on colleagues. Brother Ryan, your closing remarks, and we call it a night.
Okay, thanks everybody for your time. Thank you, Brother Liz. I hope to see you on Saturday, everybody. Take care. God bless. Love God and love people. That's what it's
Yeah,
all about.
it's the big rule.
Yep.
It's the big rule, especially your neighbor. Don't go far. Next door. Night, night, colleagues.
No answer,
Bye.
guy.
Sharp, sharp. Bye.
Everybody. I'm just going to share some slides from the actual talk looking at technique of endotracheal intubation, how not to rock the laryngoscope, how to lift it, upwards at the proper angle, for instance. This is a view of the vocal cords and how the ET tube should be placed in under direct visualization, okay? Then this is just simply spirometry this is coming from the physiological side of things, explaining tidal volumes, inspiratory, expiratory, reserve volume, residual volume, capacities, breaking into examples like that. And this is just to once again illustrate the lung compliance, which is very important parameter to monitor in ventilation. Just explaining the pathophysiology and the normal physiology, first of all, in order to understand pathophysiology. Obviously, we'll expand more on this during the actual talk.
Welcome to the Masterclass on Mechanical Ventilation Information Session. Whether you're a student, a new clinician, or a seasoned provider looking to refine your skills, we're so glad you're here. Managing critically ill patients can be one of the most challenging and rewarding parts of clinical care. And tonight, you're taking a powerful step forward. This session is designed to help you cut through the complexity, to make intubation less intimidating, and to help you approach the ventilator with confidence, not confusion. You'll learn how to perform endotracheal intubation with clarity, the fundamentals of setting up and managing a ventilator, how to protect the lungs using safe ventilation strategies. We'll also dive into non-invasive ventilation and explore the physiologic and pathologic consequences of mechanical ventilation. This masterclass is more than a lecture, it's a foundation for safer care, sharper clinical thinking, and stronger outcomes for your patients. Thank you.